Hey, my name is Michael Wang. I'm a physical therapist with NewCare Physical Therapy. Our clinic is in Norcross, Georgia, and I'm here just talking about an issue that I see very common in my clinic, which is shoulder pain. And more specifically, I want to talk about the three top areas that I see shoulder pain. And shoulder pain, it can happen to anyone. Today, I just want to go over those three things. The first area would be the front shoulder. If you have pain in the front, you're most likely dealing with biceps tendonitis. You might even feel it come down a little bit towards your elbow. And so when you have pain here, you're going to feel it probably close to one spot in this area, and it's going to be achy and sometimes a little bit sharp. Especially when you're doing something, you might feel something very sharp here. Carrying stuff, lifting stuff. And you might even feel it while you're bringing your arm overhead. But that brings us to the second area that I see pain. When you bring your arm overhead, a lot of people will feel pain in the top of their shoulder. And it will feel very bony right here. So if you go ahead and just bring your arm over on the top of your shoulder, you'll realize it's kind of bony. And as you bring your arm up into the air, you might feel some sharp pain there. And what you're dealing with there typically is some sort of impingement, normally subacromial impingement. And it's just pain that you'll feel more like a pinch because your muscle, one of your rotator cuff muscles, travels underneath the bone here. And as you're lifting it, if it's swollen, you're going to feel a pinch right there on the top. That's our second most common thing we see. And then the other area that you might have pain is in the back of your shoulder. And just imagine you're hugging yourself and you reach your hand behind towards your back. This area, that's where some people will have a lot of pain. And normally that's associated with rotator cuff injury. Rotator cuff injury meaning the muscles back here, and they're physically either pulled or yanked, maybe torn, and you'll feel it even as you bring your arm behind your head. You might feel it stretch a little bit, but you'll feel like it's right in this area, and it's going to feel more achy and more sore.